Hello, my name is Margaret Lenfest. Today I will be sharing a video tutorial on how to diagnose elbow dysplasia and perform extracorporeal shockwave therapy in canine elbows. The authors have no conflicts of interest to disclose, and informed client consent was obtained. This video is intended for beginner, intermediate, and advanced audiences. Extracorporeal shockwave therapy is often applied to musculoskeletal conditions to decrease pain and encourage optimal healing. A shockwave is an acoustic wave with a velocity higher than the speed of sound, a high amplitude pressure peak, and a low tensile wave over nanoseconds. When applied to a patient, these sound waves travel through tissue until they encounter a change in tissue density, such as a tendon, a joint capsule, or bone. Mechanical energy is transmitted into the tissue, causing tiny gas bubbles to form and then collapse. This reaction triggers the release of growth factors and anti-inflammatory cytokines that are theorized to reduce inflammation, encourage neovascularization, improve comfort, and enhance overall healing. There are two types of shock waves, focused and unfocused. Focused shockwave units generate shockwaves in a handheld trode and direct them to a single focused treatment point, with the depth being controlled by gel pads. Shockwaves commonly used in veterinary medicine are generated by electrohydraulic or piezoelectric mechanisms. Regardless of how the shockwave is produced, the tissues respond to the stimulus. When applying focused shockwaves as a treatment, the energy dose delivered, or energy flux density, is measured in millijoules per millimeter squared. Contraindications for any type of shockwave therapy include malignancies in the area to be treated, open physes, coagulopathies, lung tissue, or major vessels in the focal area. Elbow dysplasia is a very common condition in dogs. The most prevalent type of canine elbow dysplasia is degeneration of the medial coronoid process of the ulna. Pain, synovitis, reduced elbow flexion, and osteoarthritis are expected secondary to this disease. This patient was diagnosed with medial coronoid disease and underwent bilateral elbow arthroscopic debridement of the medial coronoid processes and fragment removal as a juvenile. Several years later, shockwave has been elected to help manage his secondary bilateral elbow osteoarthritis and associated discomfort. Prior to prescribing shockwave therapy, a thorough exam including a gait assessment, standing exam, and recumbent exam must be performed. A diagnosis should be confirmed with appropriate imaging such as a CT scan or well-positioned orthogonal elbow radiographs. It is important to remember that early signs of disease can easily be missed on radiographs. Additional metrics such as goniometry to record joint range of motion or objective gait analysis to assess weight bearing can further support exam findings. Having owners complete a validated clinical metrology instrument like the Canine Brief Pain Inventory will include home observations in the patient's assessment. The goal is to deliver shock waves to the medial and lateral humeral epicondyles, the medial and lateral joint capsule, and the medial coronoid process. Shockwave unit settings will depend on the size of the patient and the shockwave generator type, but generally we deliver 1,000 shocks to each elbow with an energy flux density of 0.1 to 0.2 millijoules per millimeter squared as tolerated. Number of shocks delivered can range from 500 to 2,000 depending on the generator type and patient size. Tolerance to treatment may vary between shockwave generator types, highlighting the importance of generator-specific protocol considerations. Although published data remain limited, reports describe shockwave protocols for canine elbows using electrohydraulic units. This provides a foundation for future investigation into their clinical efficacy. With the dog gently restrained in lateral recumbency, palpate the medial aspect of the elbow joint to identify the medial humeral epicondyle, olecranon, and the medial elbow compartment. Clip the hair over the medial treatment area and use isopropyl alcohol to clean the exposed skin. Shaving the hair is necessary to accurately palpate anatomy, improve transmission to the target tissues, and minimize acoustic impedance as much as possible. Apply coupling gel to the medial treatment site and position the trode perpendicular to the medial elbow compartment. As you begin to deliver the shocks, slowly move the trode over the medial humeral epicondyle, medial joint capsule, and the medial coronoid process while remaining perpendicular to these target anatomy. Areas with the greatest pain and inflammation may need a lower intensity setting. Some patients may require anti-anxiety medications or even light sedation to receive treatment from an electrohydraulic shockwave unit. Auditory protection for the patient and staff is recommended when using an electrohydraulic unit. Repeat this process on the lateral aspect of the elbow by palpating the lateral humeral epicondyle, olecranon, and lateral joint capsule. Clip the hair over the lateral treatment site and clean with isopropyl alcohol. Apply coupling gel and deliver shocks while slowly moving the trode over the target anatomic sites. Starting with a low intensity is recommended to allow the patient to become accustomed to the treatment. If the patient appears comfortable and relaxed, the intensity of the shockwave unit can be increased as tolerated. Remember to record treatments as number of shocks and millijoules per millimeter squared of energy delivered. When using an electrohydraulic unit, treatment sessions should be spaced 2 to 4 weeks apart. Sessions can be spaced 1 to 2 weeks apart when using a piezoelectric unit. The authors usually perform 3 treatments, then assess the patient's response and decide whether to continue. Reassessment of the patient is necessary to evaluate response to shockwave therapy. The veterinarian can subjectively assess the dog visually and with hands-on palpation. Repeat goniometry may show improved elbow range of motion. If available, objective gait analysis may show improved weight distribution and calculated symmetry between limbs. To capture the changes observed in the home, a validated clinical metrology instrument like the Canine Brief Pain Inventory can be readministered to the owner.